ਜਦ ਆਪਾਂ ਨੂੰ ਪੰਜਾਬ ਤੋਂ ਵੀ ਕਾਫੀ ਪਰਿਵਾਰ ਦੇਖ ਰਹੇ ਹੋਣਗੇ ਹੈ ਨਾ ਇਸ ਵੀਡੀਓ ਨੂੰ, ਸਾਨੂੰ ਵੀ ਕਾਫੀ ਮੈਸੇਜ ਆਉਂਦੇ ਰਹਿੰਦੇ ਆ ਸੋਸ਼ਲ ਮੀਡੀਆ ਦੇ ਉੱਤੇ ਉਹਨਾਂ ਦੇ, ਜਿੱਦਾਂ ਬੱਚਾ ਕੋਈ ਮਿਸਿੰਗ ਹੈ ਇੱਥੇ, ਮਤਲਬ ਇੱਥੇ ਦਰਜਨਾਂ ਨੌਜਵਾਨ ਇਸ ਵੇਲੇ ਇੱਥੇ ਮਿਸਿੰਗ ਆ ਕੈਨੇਡਾ ਦੇ ਵਿੱਚ।
A recent case that I can remember is we got a call through WhatsApp actually from India, from Punjab, for them seeking help for their family member that hasn't been in touch with them for a while. All they knew was that he was in the hospital. We had very limited information on our end to go by, but we tried to really navigate the system the best way that we could. Assigned a case manager right away. The case manager went to the hospital to try to locate this client, spoke to social workers, spoke to nurses in order to really understand what the client is going through, why they're here. They helped to facilitate communication back with the family, so letting the family know that the client is safe. From there, we helped them with immediate financial assistance for the time being, helped them get into a shelter, as well as worked on getting their documents back. They had lost everything, helping them rebuild themselves from scratch, helping them go to the consulate with them, advocating for them, supporting them through the process is definitely ways that we've supported as well.
Talking about mental health or any depression and anxiety is a taboo for our community, right? Like ਇਹ ਤਾਂ ਬਿਮਾਰੀ ਆ, right? ਆਪਾਂ ਕਿਸੇ ਨੂੰ ਦੱਸਣਾ ਨਹੀਂ, ਨਹੀਂ ਤਾਂ ਬੇਇੱਜ਼ਤੀ ਹੋ ਜੂ. What we can do as a community to normalize it?
The stigma that you mentioned, again, the taboo that mental health, especially in South Asian communities, is so strong. But the only way to really kind of deal with it or navigate it is to talk about it. Let it be a conversation. I know that there's been a lot of cases that I've heard of where a young child, for example, a teenager, they'll mention to their parents that something is off, I feel sad, I'm lonely all the time, I'm crying in my room. And the parents will be like, oh, you're on your phone too much. That's a pretty common one that we hear a lot, but they don't try to really understand where that child is coming from, right? Like they don't understand the pressures that they may be facing in the school system. So I feel like having it be an open conversation, like for parents, talk to your kids. For kids, talk to your parents. Not even just that, but talk to the elders in your family as well too, right? Your grandparents, especially for those that are, again, like they're coming from back home. They may have signs of depression, but we're not understanding it. It's not a thing in our community, as we mentioned, right? So really bringing awareness, talking about it is the only way that people will open their ears, people will open their eyes to the different issues that our community is facing, educating themselves, attend workshops, attend information sessions as well too, to really just increase your knowledge on it as well too. We're in mental health. That doesn't mean that every person who is experiencing financial difficulties or homelessness also is suffering from mental health concerns as well too, right? So a lot of times, again, if they just call us, explain what's going on, let us know what your concern is, let us know what your problem is, what difficulties you're facing, and we will find somewhere to support you. And if we can't support you within the organization, we will provide external resources of people that can support you.
So what type of resources are available, and what types of cases you guys are seeing?
We honestly offer different support, so anything from youth related programming all the way to seniors and elderly programming as well. We can touch on those in a little bit as well too, but currently in terms of mental health support and going back to international students, how you did mention, we offer a variety of support. So we offer one-to-one counseling if you're more comfortable just doing the one-to-one supports. We also do have a variety of group programming available as well. So everything from women's group, that's again exclusively for women. We have virtual support groups. We have in-person support groups, community support groups. We do outreaches at different events that we try to organize, different workshops, forums as well to really try to spread awareness. Where we offer some financial supports as well, trying to find housing supports in terms of employment preparedness. So how to even search for a job. For some students, they unfortunately, it's a lot different here in Canada, so their experience is a little bit different in comparison to how they may have searched for jobs in the past. So we help them, again, tailor their resumes to the jobs that they're applying for, tailor their cover letters as well, and even help them prepare for interviews too.
We talk about the food and gift card, the coupons that you mentioned.
So the gift cards, we give Walmart gift cards.
Hanji.
So they can buy groceries, medication, because of Walmart pharmacy as well too, right? So if they need medication supports, they can kind of get everything, baby supplies, clothing. Especially, for example, we have walk-in clients all the time, right? So somebody comes in, they walk in, they need that support. That's something that we're able to provide right away. For example, they come in and they're saying that they have not eaten in like 2-3 days. They don't have food. They don't have money for diapers for their baby. They're really struggling. They don't have money for even clothes or hats or something in the winter as well too. We're going to provide them whatever immediate assistance we can, try to help them support. For anything a little bit more long-term, for that, the eligibility criteria would be determined by, again, the team, the appropriate team. But for immediate assistance, we do try to provide at least gift cards or something that we can help with. All you really need to do at the end of the day is give us a call. As I mentioned, like, we will find some way that we can try to support you, whether it's through us, whether it's through somebody else, but we will definitely do our best to try to support you and help you navigate the system.
ਵਾਹਿਗੁਰੂ ਜੀ ਕਾ ਖਾਲਸਾ ਵਾਹਿਗੁਰੂ ਜੀ ਕੀ ਫਤਿਹ। ਸਿੱਖਿਆ ਦੇ ਅਗਲੇ ਐਪੀਸੋਡ ਦੇ ਵਿੱਚ ਤੁਹਾਡਾ ਸਵਾਗਤ ਹੈ ਜੀ। ਜਿਹੜਾ ਆਪਣਾ ਅੱਜ ਦਾ ਐਪੀਸੋਡ ਹੋਇਆ ਇਹਦੇ ਵਿੱਚ ਆਪਾਂ ਨੇ ਕੋਲ ਦਪਿੰਦਰ ਆਏ ਸੀਗੇ PCHS ਤੋਂ, ਜਿਨ੍ਹਾਂ ਦਾ ਜਿਹੜਾ ਫੀਲਡ ਵਰਕ ਹੈਗਾ, ਜਿਵੇਂ ਉਹ ਪੇਸ਼ੇ ਤੋਂ ਆਪ ਨਰਸ ਨੇ, ਫਿਰ ਉਸ ਤੋਂ ਬਾਅਦ ਉਹ PCHS ਦੇ ਵਿੱਚ ਇਨਵੋਲਵ ਆ। ਚਾਹੇ ਉਹਨਾਂ ਦਾ ਐਡਿਕਸ਼ਨ ਪ੍ਰੋਗਰਾਮ ਆ ਜਾਂ ਮੈਂਟਲ ਹੈਲਥ ਦਾ ਪ੍ਰੋਗਰਾਮ ਆ, ਉਹਦੇ ਵਿੱਚ ਉਹਨਾਂ ਦਾ ਕਾਫੀ ਐਕਸਪੀਰੀਅੰਸ ਹੈਗਾ। ਅਤੇ ਅੱਜ ਵਾਲੇ ਪ੍ਰੋਗਰਾਮ ਦੇ ਵਿੱਚ ਜਿਹੜੀ ਉਹਨਾਂ ਨੇ ਗੱਲ ਕੀਤੀ ਆ ਕਿ ਜਿਹੜੀ PCHS ਆ, ਪੰਜਾਬੀ ਕਮਿਊਨਿਟੀ ਹੈਲਥ ਸਰਵਿਸਿਜ਼ ਆ, ਉਹਨਾਂ ਦੀਆਂ ਕਿਹੜੀਆਂ ਸੇਵਾਵਾਂ ਹੈਗੀਆਂ ਆ, ਕਿਹੜੇ ਰੀਸੋਰਸਿਸ ਹੈਗੇ ਆ ਉਹ ਪ੍ਰੋਵਾਈਡ ਕਰਦੇ ਆ। ਅਤੇ ਇਹ ਪ੍ਰੋਗਰਾਮ ਆਪਾਂ ਪੰਜਾਬੀ ਦੇ ਵਿੱਚ, ਇੰਗਲਿਸ਼ ਦੇ ਵਿੱਚ ਮਿਕਸ ਕੀਤਾ, ਦੋਨੋਂ ਭਾਸ਼ਾਵਾਂ ਦੇ ਵਿੱਚ, ਤਾਂ ਕਿ ਜਿਹੜੇ ਵੱਧ ਤੋਂ ਵੱਧ ਜਿਹੜੀ ਆਡੀਅנס ਆ ਉਹਨਾਂ ਤੱਕ ਆਪਾਂ ਰੀਚ ਆਊਟ ਕਰ ਸਕੀਏ। ਅਤੇ ਇਹਦੇ ਵਿੱਚ ਉਹਨਾਂ ਨੇ ਦੱਸਿਆ ਕਿ ਕਿਵੇਂ ਉਹਨਾਂ ਦੀ ਆਰਗੇਨਾਈਜੇਸ਼ਨ ਹੈਲਪ ਕਰਦੀ ਆ, ਫਾਈਨੈਂਸ਼ੀਅਲ ਅਸਿਸਟੈਂਸ, ਜਾਂ ਫਿਰ ਕਿਸੇ ਨੂੰ ਰਹਿਣ ਦੇ ਲਈ ਰੈਂਟਲ ਹੈਲਪ ਦੀ ਲੋੜ ਆ, ਜਾਂ ਫਿਰ ਐਡਿਕਸ਼ਨ ਦੇ ਵਿੱਚ, ਜਾਂ ਫਿਰ ਡਾਇਬਟੀਜ਼ ਨੂੰ ਲੈ ਕੇ ਸੀਨੀਅਰ ਦੇ ਲਈ ਉਹਨਾਂ ਦੇ ਕੋਲ ਕਾਫੀ ਪ੍ਰੋਗਰਾਮ ਆ। ਮੈਂਟਲ ਹੈਲਥ, ਡਿਪਰੈਸ਼ਨ, ਐਂਗਜ਼ਾਇਟੀ, ਇਹਦੇ ਲਈ ਉਹ ਕੇਸ ਵਰਕਰ ਜਿਹੜੇ ਆ ਉਹ ਅਸਾਈਨ ਕਰਦੇ ਆ, ਜਾਂ ਫਿਰ ਜਿਹੜਾ ਇਹਨਾਂ ਦਾ ਇੱਕ ਵਾਈਡ ਸਪੈਕਟਰਮ ਹੈਗਾ ਜਾਂ ਕੰਮ ਕਰਨ ਦਾ, ਉਹਦੇ ਬਾਰੇ ਆਪਾਂ ਗੱਲਾਂ ਬਾਤਾਂ ਕੀਤੀਆਂ। ਅਤੇ ਅੱਜ ਦੇ ਪ੍ਰੋਗਰਾਮ ਦੀ ਖਾਸੀਅਤ ਇਹ ਆ ਕਿ ਆਪਣੇ ਹੁਣ ਪਿਛਲੇ ਕਈ ਸਾਲਾਂ ਤੋਂ ਆਪਾਂ ਦੇਖਿਆ ਕਿ ਇੰਟਰਨੈਸ਼ਨਲ ਸਟੂਡੈਂਟਸ ਆ, ਉਹਨਾਂ ਦੀਆਂ ਪ੍ਰੋਬਲਮਸ ਬਹੁਤ ਜ਼ਿਆਦਾ ਵੱਧ ਰਹੀਆਂ। CBC ਨੇ 2022 'ਚ ਰਿਪੋਰਟ ਕੀਤਾ ਸੀਗਾ ਕਿ 4 ਤੋਂ 5 ਜਿਹੜੀਆਂ ਡੈਡ ਬੋਡੀਜ਼ ਆ ਇਹ ਹਰ ਮਹੀਨੇ ਵਾਪਸ ਬੈਕ ਹੋਮ ਜਾ ਰਹੀਆਂ ਆ ਉਹ। ਸੋ ਇਹ ਜਿਹੜਾ ਇੱਕ ਇੰਨਾ ਵੱਡਾ ਕ੍ਰਾਈਸਿਸ ਆ, ਇਹ ਮਤਲਬ ਵੱਧਦਾ ਜਾ ਰਿਹਾ ਅਤੇ ਘਟਣ ਦਾ ਕੋਈ ਨਾਮ ਨਹੀਂ ਰਹਿ ਰਿਹਾ। ਅਤੇ ਐਟ ਦ ਸੇਮ ਟਾਈਮ ਜਿਹੜੇ ਜਿੱਦਾਂ ਹੈਲਪ ਚਾਹੀਦੀ ਹੁੰਦੀ ਹੈ ਇੰਟਰਨੈਸ਼ਨਲ ਸਟੂਡੈਂਟਸ ਨੂੰ, ਉਹਦੇ ਬਹੁਤ ਲਿਮਿਟਿਡ ਚੈਨਲਸ ਹੈਗੇ ਆ, ਬਹੁਤ ਲਿਮਿਟਿਡ ਸੋਰਸਿਸ ਹੁੰਦੇ ਆ। ਸੋ ਅੱਜ ਦੇ ਪ੍ਰੋਗਰਾਮ ਦੇ ਵਿੱਚ ਆਪਾਂ ਕੋਸ਼ਿਸ਼ ਕੀਤੀ ਆ ਕਿ PCHS ਦੇ ਨਾਲ ਗੱਲਬਾਤ ਕਰਕੇ ਕਿ ਉਹ ਕਿਹੜੀ ਮਦਦ ਆ ਜਿਹੜੀ ਉਹ ਫ੍ਰੀ ਆਫ ਕਾਸਟ ਵਿਦਿਆਰਥੀਆਂ ਦੀ, ਵਰਕ ਪਰਮਿਟ ਹੋਲਡਰਾਂ ਦੀ, ਜਾਂ ਵੈਸੇ ਕਮਿਊਨਿਟੀ ਦੀ ਇਨ ਜਨਰਲ ਕਰ ਸਕਦੇ ਆ। ਅਤੇ ਇਸ ਤੋਂ ਇਲਾਵਾ ਆਪਾਂ ਆਉਣ ਵਾਲੇ ਟਾਈਮ ਦੇ ਵਿੱਚ ਜਿਹੜੀਆਂ ਹੋਰ ਆਰਗੇਨਾਈਜੇਸ਼ਨਸ ਹੈਗੀਆਂ ਆ, ਕਮਿਊਨਿਟੀ ਆਰਗੇਨਾਈਜੇਸ਼ਨਸ ਅਤੇ ਜਾਂ ਸਟੇਕ ਹੋਲਡਰ ਹੈਗੇ, ਉਹਨਾਂ ਨਾਲ ਰਲ ਕੇ ਆਪਾਂ ਹੋਰ ਪ੍ਰੋਗਰਾਮ ਕਰਾਂਗੇ, ਉਹਨਾਂ ਨਾਲ ਗੱਲਬਾਤ ਕਰਾਂਗੇ, ਤਾਂ ਕਿ ਇੱਕ ਜਿਹੜੀ ਵਿਜ਼ਡਮ ਹੈ, ਜਿਹੜੀ ਜਾਣਕਾਰੀ ਆਪਾਂ ਵੱਧ ਤੋਂ ਵੱਧ ਸ਼ੇਅਰ ਕਰ ਸਕੀਏ। ਸੋ ਤੁਸੀਂ ਆਪਦੇ ਫਰੈਂਡ ਸਰਕਲ ਦੇ ਵਿੱਚ, ਆਪਣੇ ਨੈਟਵਰਕ ਦੇ ਵਿੱਚ, ਫੈਮਿਲੀ ਫਰੈਂਡਸ ਦੇ ਨਾਲ ਇਹ ਵਾਲੀ ਵੀਡੀਓ ਆ ਜਿਹੜੀ ਜ਼ਰੂਰ ਸ਼ੇਅਰ ਕਰਿਓ, ਕਿ ਤਾਂ ਕਿ ਰੱਬ ਨਾ ਕਰੇ ਕਿਸੇ ਨੂੰ ਇਹਨਾਂ ਚੀਜ਼ਾਂ ਦੀ ਜੇ ਇਨ ਫਿਊਚਰ ਲੋੜ ਪੈਂਦੀ ਆ ਤਾਂ ਉਹਨਾਂ ਨੂੰ ਘੱਟੋ ਘੱਟ ਪਤਾ ਹੋਵੇ ਕਿ ਉਹ ਇਹਨਾਂ ਆਰਗੇਨਾਈਜੇਸ਼ਨ ਦੇ ਕੋਲ ਜਾ ਕੇ ਉਹ ਜਿਹੜੀ ਲੋੜੀਂਦੀ ਮਦਦ ਆ ਉਹ ਪ੍ਰਾਪਤ ਕਰ ਸਕਦੇ ਆ। ਟੁਡੇ ਵੀ ਹੈਵ ਅ ਸਪੈਸ਼ਲ ਗੈਸਟ ਫਰੋਮ PCHS. Whenever we have any case related to mental health, addiction, someone is homeless, someone need any sort of help, and we always reach out to PCHS, Punjabi Community Health Services. And today we have Dipinder from there, and let's start this conversation. Tell us about yourself, how you get involved in PCHS, and how was your previous experience?
Of course. So I'm Dipinder. I'm the program supervisor for our mental health programs, as well as our Better Families and family enhancement programs as well. So I started with PCHS about 3 years ago. Initially, I joined in as a nurse on our mental health team. I enjoyed the experience so much that I, of course, had to stay with PCHS. There's a lot of wonderful initiatives, wonderful clients, wonderful programs that we do offer to support. So it's a really, really great organization to be a part of.
How long you've been working with the PCHS?
I've been with PCHS for about 3 years now.
I think you have a lot of diverse experience with working with people from different age groups, right? From teenagers to old people. So recently we have seen a big number of international students coming in, and also at the same time the issues were growing, especially related to mental health. I know personally many people reaching out to me, asking for resources, asking for help available, and I always refer them to PCHS. And how is the situation from your side? Because I know it's not only me, many other people, many other community organizations will be referring people to PCHS. How does it look like from your perspective, from being insider of the organization? How big the problem is, and what's actually going on from inside?
Sure, that's definitely a great question. In my personal opinion, I think the issue is growing. I think it's growing day by day. Ever since COVID has happened, to be honest, I feel like mental health concerns, especially in the South Asian community, have increased significantly. In terms of referral process and everything else, like you were mentioning, we accept referrals from anywhere. It's some family members might think that it has to come from a doctor or it has to come from a physician, psychiatrist, but that is not the case. We accept referrals from yourself. All you have to do is pick up the phone and give us a call, or even if you just go online at www.pchs4u.com, you can just fill in an inquiry over there. We accept referrals from anywhere and everywhere. Our goal is to help the community and help as many members of the community as possible. So we really try to help out and support in any way that we can.
So what type of resources are available, and what types of cases you guys are seeing in recent months or years?
Yep. So we honestly offer different support. So anything from youth related programming all the way to seniors and elderly programming as well. We can touch on those in a little bit as well too. But currently in terms of mental health support and going back to international students, how you did mention, we offer a variety of support. So we offer one-to-one counseling if you're more comfortable just doing the one-to-one supports. We also do have a variety of group programming available as well. So everything from women's group, that's again exclusively for women. We have virtual support groups. We have in-person support groups, community support groups. We do outreaches at different events that we try to organize, different workshops, forums as well to really try to spread awareness. In terms of other supports that we also do offer, we offer some financial supports as well, trying to find housing supports in terms of employment preparedness. So how to even search for a job. For some students, they unfortunately, it's a lot different here in Canada, so their experience is a little bit different in comparison to how they may have searched for jobs in the past. So we help them, again, tailor their resumes to the jobs that they're applying for, tailor their cover letters as well, and even help them prepare for interviews too.
Wow, that's really good. That's also what we do here at Sikheya.
Awesome.
So regarding the, you know, as you mentioned, the situation is getting bad day by day. So tell us more about what types of cases you guys are coming across. Any specific case or example that you want to share?
So some of the cases that we've had recently, it can be some international students that have lost everything, that they're on the streets, they're homeless, they don't even have a single cent or dollar to their name. We help them from the ground up. So everything from securing documents to for passports, to applying for their license again, to applying for any sort of identification, to help them navigate the consulate as well to try to get back home. We do try to offer supports in many different ways. We've had cases where, again, other than being homeless, they're so depressed that they're suicidal. We get calls from the hospitals that this person is in the hospital, they're not even able to speak. We've had a lot of those recently. And the way that we try to communicate with the client and try to build that trust and rapport is by connecting with their family members. We use WhatsApp to connect with their family members back home in order to try to see how best we can try to support the clients in whatever capacity that they may be in currently.
Yeah. So say someone is homeless, their status is expired, maybe they're drug addict too. What are the like actual resources or actual thing they can have, like PCHS can help them to get their passport again, but what about the visa, like their status is expired, what type of help they can get? Because I think your immigration status also limit what you get or what you not, right? So how you guys navigate through that situation? Because recently we have seen the number of people getting out of status is just going through the roof, right?
Definitely. So, what our services do offer, so again, in different types of our programming, there are different eligibility criteria, right? So, the status definitely does matter for certain programming. However, again, if you're faced with these unfortunate circumstances where it's kind of out of your control and you're homeless and you're recently like addicted to drugs, for example, in cases like that, what we really can support with, and the only thing that we can support with is really to help navigate the system and try to kind of try to get back on their feet, trying to get them to go back home or get their paperwork in order. If they need us to go with them to the consulate to help file appeal, for example, that's also something that we do support with as well.
And in terms of housing, how you guys help with that for especially for the homeless people? What are the options? If because recently we have seen many videos of people, living in parks or living in the in the ATMs or in shopping plazas, and so this was specifically regarding if they want to go back, if they want to get their documents back, they can get help from PCHS. But what if they want to stay here? What if they want to restart their life again? How, whether it is housing or immigration status, what are the available resources regarding that?
So what we can do is we can try to get in touch with local shelters to try to see if they're able to support in any capacity. And again, there are some shortcomings with that, unfortunately, as well, too, right? It depends on status. For some shelters, for example, if an international student was to call in and say that they need help and they need a bed to sleep in, they will simply say, sorry, we can't support. Just as soon as they hear international student, the phone's kind of hung up. So we try to really help them try to navigate that process, and we try to take on that work for the student or for the client that we do have. So we'll make the calls, we'll try to reach out to all of our resources that we can in order to try to secure them some sort of housing. If all kind of fails, like for example, like even if we find them like in a basement apartment, we can try to support with like first month's rent or last month's rent, or even offering if there's a client that's on the verge of homelessness, right? So they're in the verge of being evicted, we can try to help them navigate the situation with their landlord, offer them different resources in terms of that, and even try to offer to pay for a month as well too.
So what is the eligibility criteria for that? Because I know when you say, okay, we can, if you are at right at the edge, we can pay rent for you, but unfortunately, you will see too many people coming in for that help. What is the eligibility criteria? How you guys make sure that, okay, this person needs help or this person maybe doesn't need help for now?
Yes, so our Sahara Support Services, they deal with the financial assistance and financial support. So they have a different eligibility criteria that they use. So once again, let's say that they're referred to the mental health program, they're working with a mental health case manager, and that case manager, while working with them, again, identifies that need for financial assistance and support. What we do is we do a lot of internal referrals to the great programs that we have at PCHS. So they would provide an internal referral to Sahara Support Services. In that case, Sahara Support Services, a case manager from there would contact the client. They would work with them to assess their financial situation, their financial difficulties. The client would go into a little bit more detail with that member from the Sahara Support Services team, sorry. And then that's how they would kind of navigate that situation and determine the eligibility.
Yeah, so there will be due diligence just to figure out
Yes.
what the actual situation is and then try to help them accordingly, right?
Definitely.
And you mentioned the landlord and tenant issues as well. We are getting many messages from people that their landlord kept their stuff or evicted them before 38 or something like that, or they kept their rent and now asking them to leave. What help is available there? And if you have come across any such cases, how you guys would help them?
So we can provide them with different resources. Sometimes, again, unfortunately, tenants aren't aware of the resources that are available
Yeah,
to
I think it is
support them, right?
always they are not aware, right?
Yeah.
It's pretty unfortunate.
Yeah. So like the landlord tenant board, for example, filing an appeal to the board as well too. That's something that we can help them work towards, help them navigate towards. Just honestly, any sort of resources that we can provide. Sometimes again, it can be just a language barrier, it can be that communication issue, right? So sometimes us stepping in as a third person, again, with the consent of the client, of course, we're kind of able to help them navigate that, or try to request for an extra month or extra time or anything of that sort. So really just every client is different, every client is individual, and every client has their own certain set of circumstances. So we really just try to help support each client on an individual basis, right? The best that we can.
Yeah, so you just mentioned that there are a couple of paths paths going forward for the people who are homeless or who need help, including the shelters. How's the situation at the shelters? Because when I talk to people, they were like, sometimes the situation just gets worse. As you mentioned, there are shelters who does not accept international students, so there's already a barrier, right? Not everyone can get help from there. But even if the shelters who accept international students or PGWPs or whatever, the situation is not very good over there, right? I mean, the problem of drug over there and the cleanliness or hygienic situation is not very good over there. What's your thoughts on this, or if you have any example how someone can navigate through that, how someone can get back to the mainstream life from that situation?
For sure. So our goal essentially is to get our clients to a place of safety, right? So if we're to determine that the clients are homeless, they're living on the streets, they're not safe at that point, being in a shelter is kind of better than being in the streets, right? So we really just again want to get them to safety, and we stress the fact to them as well too. The shelters are a temporary support. They're not something that you're looking at long term. It's temporary for you to be comfortable, for you to have a bed to sleep in, for you to have a safe place for you to be at night, especially in the colder weather as well, right? So what we kind of do is in terms of And I can provide an example of that as well too. So we received a call to our family enhancement program. There was a client, she was a single mother, and she was homeless. The in-laws had kicked her out once her husband had passed away. And this client essentially had nothing. She's on the streets with, I think, a child that was less than 5 years old. So really unfortunate circumstances to be with. So the way that we helped and the way that the case manager supported right away, we have gift cards that we provided her for the grocery store to get some food, to get some supplies, much needed supplies for baby as well too. Connected her with a family shelter, which tend to be a little bit safer. So she connected her with a family shelter, and from there she was able to kind of start on the housing process for the client as well too, for low income housing, trying to get them connected with ODSP, Interior Works, helping them with the applications, letting them know about the different financial assistance programs we have as well too, right? Our end goal essentially is not just to get a client into a shelter. The shelter is a temporary place of means for the client's safety and to secure the safety for the time being. So while they are there, we are working in the background on different components that we can try to get for the housing, right? Whether it be, again, like a basement, whether it be low income housing, whether it be applying for financial assistance for them through different government assisted programmings. We try to really just try to get them off the floor or off the rock bottom that they may be at, and try to again help them gain that normalcy back into their lives.
But those government assistance programs are not for the international students, right? They are for the PRs and refugees and
Yes,
citizens,
so it
I
depends on
believe.
your qualifications, right? Or it depends, again, like each program has different eligibility criteria. I know the government also offers like the one-time financial assistance as well too. So it really just depends on eligibility criteria. So that's what our workers are here
Yeah,
for, to help the clients kind of navigate through the system, because every program has different eligibility criteria. It can be really overwhelming and really confusing as
true.
well.
When you guys evaluate that someone might just need financial assistance for the rental housing, or someone might need to go to a shelter, I mean, what is the breaking point? How you guys evaluate that, if you guys can just help them financially or right at the spot, or maybe refer them to a shelter?
So honestly, it really just depends on the individual client and their circumstances. So just because, again, like we're in mental health, that doesn't mean that every person who's experiencing financial difficulties or homelessness also is suffering from mental health concerns as well too, right? So a lot of times, again, if they just call the phone, call us, explain what's going on, let us know what your concern is, let us know what your problem is, what difficulties you're facing, and we will find somewhere to support you. And if we can't support you within the organization, we will provide external resources of people that can support you. So again, if it's, for example, somebody calls in, they say that they're about to be or on the brink of eviction, we're not going to kind of make them push them through the system, go through this avenue, go through that avenue. We're going to get them in touch with somebody who can help, whether that be from us or whether that be from somebody external.
Okay, so help is always out there, but I think it is more about the awareness or the navigation, how to actually
Yes.
navigate right from the system. Yeah, you mentioned that the cases of single mothers recently, especially after COVID, we got many messages from girls who are single mothers. I mean, you mentioned a situation where her husband died, right, and that the family in-laws were not supporting, but also at the same time, sometimes it is a girl is still international student, and her boyfriend left them when they got to know about the situation and stuff like that, and now it's too late for the abortion, and sometimes they can't even tell their parents, and sometimes they don't have anything to they don't even have a job, they don't know if they should focus on their study, on their immigration status, uh, or think about the pregnancy they're going through. We're getting messages if our organization can help them to cover the medical expenses, stuff like that, and they're asking if insurance can cover all of those expenses. I'm pretty sure you guys also getting these similar cases, right? And how you guys help them to navigate through this situation, through this toughest situation, I would say, right?
Of course. So our case managers, they work one-on-one with the clients, right? Really trying to assess their needs. So we have different assessments, we have care plans, we have goals and objectives that we work with the client. The client defines their own goals, their own objectives, whatever they may look like for them, right? So if her primary goal, for example, for a client that like how you had just mentioned, her primary goal is just to make sure that she has a healthy pregnancy. And in order to, let's say, for financial assistance as well, too, that is what we're going to work on her with. The client will identify the goals that they want to work with, and we will support them in terms of reaching that goal. So, in terms of like a healthy pregnancy, again, providing that education, providing that support, providing navigation assistance as well, too, on how to access the different parts of the systems, right? And again, our systems are different than they are back home
Yep.
as well too. So help them understand a brand new healthcare system that they may not have been aware of or may not have had to enter before. So just really help them navigating the challenging moments and challenging situations that they're facing.
So, what sort of financial help can be available?
It
And
really just depends. So again, if it's rental assistance, if it's food supports, if it's helping them even sign up for ODSP, OW, helping them sign up for different financial supports, or even helping them to explore if they want to look for a job, helping them look for a job.
I think the most critical situation is sometimes when you got to know that your friend, your roommate, someone from your family is suicidal, they're having suicidal thoughts, or you just saw a significant change in their behavior and you know that something is just not right. What someone should do? Because I remember a few years ago, I mean, when I was part of the student organization, and then someone from an organization told me that the moment someone mentioned that they are having suicidal thoughts, you need to call the crisis line. It's your responsibility to do that right away. It doesn't matter. You shouldn't be thinking that how your relationship with that person should be. They're gonna be mad at you that why you call police or why you call that helpline. But they were like, no, you should be doing that call. You should be making that call. So how someone can navigate through that situation when they get to know that they're the person they're living with or their friend is going through that situation.
It's definitely, of course, a difficult situation to be a part of. And for a lot, it's a very scary situation. They
Yeah.
may not have ever had to deal with anything like this before, even thought about suicide, much less be living with somebody who is having those thoughts and having those feelings and sharing it with them. So it can be definitely uncomfortable, but knowing how to support them, and if you're not able to support them, how to find those resources to support them is definitely something that's very important. And it's not as talked about in our community, unfortunately. But one of the things I can say is, again, offer them a safe space, non-judgmental, right? If they want to talk, listen. But in terms of accessing resources, if you're not sure of where to call, again, like there's a suicide helpline 988, there's crisis, how you mentioned as well too, calling the police. You can ask them to do a wellness check as well too. If you feel like you want to give us a call, we can help you navigate through the process as well too. All you have to do is pick up the phone and call us at any point. Whoever answers the phone, whether it be somebody from reception, whether it be intake, whoever it may be, will guide you towards the best path that you can use for the situation.
Yeah. I mean, what are the possible ways and how they all work out separately?
So there's different ways, right? So if you call 911, for example, you can also always go to the emergency room, go to the hospital, explain the thoughts. But sometimes the issue that happens is that the person that's living with you or your friend or your family member, they don't want to go, right? Like you want to support them, you want to take them to the hospital, you want to get them help, but that person doesn't want to receive the help. So in that case, you're a little bit limited in what you can do, right? But what you can always do is try to provide that education to that person, be that support system that they need, right? Let them know, hey, like when you're ready to talk, I am here.
Yep.
I can guide you, I can help you. Even if you don't know what to do for them or anything like that, that's okay. That's not your job at the end of the day, right? You should be leaving that trust into somebody that is more maybe trained to handle that supports. But what you can do is help guide them on where to find that help, on how to call the helpline, how to share those thoughts. And again, all of these lines are usually confidential as well too, right?
Yeah. I remember at Gurdwara, a person just walk in. So I think she was recently married lady, and she was having suicidal thoughts, and actually she was attempting a suicide somewhere around the Gurdwara, and then someone just saw her and brought her to the Gurdwara, and we called. I don't remember. I think it was 988, and they came in. There was a caseworker, there was a police officer, and I think there was an ambulance too. They just came right away, and then they evaluate the situation, and then started helping them. But I think the biggest problem or the biggest issue is the resources after that situation, right? Someone is suicidal when they're staying with their family or even staying with their friends or maybe staying alone. They it is that situation, it is the environment that put them into that situation. After that, someone figured out, they called police or they called that crisis helpline, they went to hospital, they got their medication or something, and then unfortunately they came back to the same home, the same room, and now the things are gonna start affecting them again, right? And I think at that point they need some sort of support service, someone who can stay them with them all of the time, or someone who can look after them. And I think this whole thing is missing, right? And that's pretty unfortunate, because I talked to some other people from PCHS too, and they brought the same point, that I think that the part is still missing. Basically, like 24-hour support, right? I mean, we can't, because they're already living away from the family, right? There won't be any brother, sister, or mom, dad who can look after them all of the time. They eventually have to go back to the same situation.
In that case, so that's kind of where we step in, like in terms of our case management supports, right? Again, usually when clients are suicidal and they're in the hospital, we are brought on, especially if they're Punjabi speaking individuals as well too, or belong to the South Asian community. What our case managers would do is, even before they get discharged, they would meet them at the hospital. We've had cases where we get a call from the hospital social worker saying there's a client, he's in crisis, attempted suicide, we need support. What we do is our case managers would get assigned on that right away. They would go to the hospital. They would speak with the client if they're able to. If not, if there's family members there, we would get consent, speak to the family members in terms of the situation. We would try to develop some sort of plan with the client so that when they do go home and when they are discharged, how you mentioned, they don't feel like they don't have support. They know that somebody is here, that they can give us a call. And usually, again, we have peer support workers as well too that help them if they need more frequent check-ins, if they want somebody to, even if it's a call a day, just to be like, hey, how are you? Are you doing okay? Do you need anything? What, even a call makes a difference.
Yep.
And especially if somebody is at rock bottom and they are extremely lonely, they don't feel like they have anything, they feel like they have no support. So really trying to show them that we are here to help you. We are your support system. Let's help you work together, work towards normalcy at least, whatever that may look like for you.
Makes sense. So right now, we know because of the economic slowdown, there are not enough jobs in the market, right? And international students or PGWP holders are suffering a lot. How PCHS can help them to cope with the mental stress they're going through, because the situation is majority of the international students have, the parents have spent lifetime savings, right, on their education, and now they're in Canada, they're studying, but they need to work part-time or full-time along with their studies, just to to pay their expenses, to pay their bills. And it is really I mean, it has a lot of big toll on their mental health, right? Finding a job and then coping up with that situation. And what type of resources PCHS can provide, or how they should navigate through that situation, finding a job and also making sure they have their peace intact at the same situation.
That's what we really, again, try to strive to support with through PCHS is providing that holistic service delivery, right? So not just one and done kind of situation or just helping them in one aspect and forgetting about the rest. No, we try to help them as a whole, try to help them in every kind of capacity that they need that support in. So whether it be the pressures that they're facing and the struggles it's having on their mental health, all the way down to supporting them with working on their resume, let's say, right? Helping them search for jobs, helping them practice for interviews, like what interview questions they might expect at a job, doing mock interviews with them. It really just ranges. All somebody needs to do is give us a call. Let us know you need support. Let us know what we can help you with here. We are here to help, but we need you to give us that call or search us online and put in an inquiry, right? Let us help you.
No, definitely. And what types of other programs PCHS is running right now? I don't. I mean, it helps wide range of community people from all age groups. There are different programs for different section of people, right? What are the other initiatives or programs PCHS running right now?
Sure. So we have mental health programs, as we've discussed. We have addictions programs as well. We have newcomer support programs. We have senior supports as well. We have financial assistance. We have Sahara health promotion and prevention programs like diabetes testing, breast cancer awareness. They run a lot of wonderful workshops and initiatives as well too. Our geriatrics program, they offer so many seniors groups that have wonderful activities, different educational experiences for seniors. I've done a few mental health topics as well, so as a team at these seniors presentations, and they love to learn. It's a really interactive experience for them. And again, it's about socialization, right? Otherwise, what would you be doing for that time period, for those 2 hours? You'd be sitting at home. At least this where you're getting out, you're talking to others, you're building that connection, building that sense of community as well too. And then through our geriatrics program, we also have our Longer on Wheels program, which helps to provide meals to those who need it the most. Seniors that may be disabled or they're not able to cook for themselves as well too. So through that, they also have respite programs, so providing those supports as well overnight or during the day.
Yeah, no, that's really good. We know there are many support services out there, but also there is a very big gap, right? As a community, we have a long way to go. Just for example, a few years ago, a family reached out to me from Punjab. Their son was missing, and we put his photo on social media. Tried asking people, and someone sent me a message that, "Hey, bro, I mean, the police found his dead body last night." And that was like very unfortunate. I talked to him, and he was like, okay, he committed suicide in in GTA, but he was from Montreal, and I called his uncle. It was really hard for me to call him and then talk to him about it. That someone sent me a message that this happened, and when I talked to him, I was like, okay, someone told me that this has happened, and that he was in depression from last couple of weeks. He wasn't talking to anyone very well, and he just did it last night, and or 2 days ago, and they were like, no, 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 no way. He wasn't mentally ill. He was all good. It was an accident. I was like, no. His friends told me that wasn't an accident. He committed suicide, but they never agree. They were like, no, it was an accident, and they didn't even told me. They were like just asking me to find him, like make a social media campaign to see what's going on. But I mean, these kind of situations when talking about mental health or any depression and anxiety is a taboo for our community, right? They think that it is like ਇਹ ਤਾਂ ਬਿਮਾਰੀ ਆ, right? ਆਪਾਂ ਕਿਸੇ ਨੂੰ ਦੱਸਣਾ ਨਹੀਂ, ਨਹੀਂ ਤਾਂ ਬੇਇੱਜ਼ਤੀ ਹੋ ਜੂ। That ਜਿਹੜੀ ਇਹ ਵਾਲੀ situation ਆ, I mean, what we can do as a community to normalize it, because this is a problem, this is a disease, which is it is already normalized, right? It is happening in every household, in every community, but we just don't talk about it. Or even if we are talking, then we figure out that we don't have resources to properly navigate through. What's your take? I mean, what we need to do as a community for such situations?
The stigma that you mentioned, again, the taboo that mental health, especially in South Asian communities, is so strong. But the only way to really kind of deal with it or navigate it is to talk about it. Let it be a conversation, openly talk about it. I know that there's been a lot of cases that I've heard of where a young child, for example, a teenager, they'll mention to their parents that, like, I'm not feeling, something is off. I feel sad. I'm lonely all the time. I'm crying in my room. And the parents will be like, oh, you're on your phone too much.
Yeah.
That's a pretty common one that
Yeah.
we hear a lot, but they don't try to really understand where that child is coming from, right? Like they don't understand the pressures that they may be facing in the school system. So I feel like having it be an open conversation, like for parents, talk to your kids. For kids, talk to your parents. Not even just that, but talk to the elders in your family as well too, right? Your grandparents.
Yeah.
Especially for those that are, again, like they're coming from back home. They may have signs of depression, but we're not understanding it. It's not a thing in our community, as we mentioned, right? So really bringing awareness, talking about it is the only way that people will open their ears, people will open their eyes to the different issues that our community is facing, educating themselves, attend workshops, attend information sessions as well too, to really just increase your knowledge on it as well too.
Is there any specific case that you want to share? We just talk about the students getting missing or getting out of status, and then families trying to reach out, and then what the families can do, or if there's any case example that you want to share.
Sure. So definitely just all you really need to do at the end of the day is give us a call. As I mentioned, like we will find some way that we can try to support you, whether it's through us, whether it's through somebody else, but we will definitely do our best to try to support you and help you navigate the system. So a recent case that I can remember is we got a call through WhatsApp actually from India, from Punjab. For them seeking help for their family member that hasn't been in touch with them for a while. All they knew was that he was in the hospital. We had very limited information on our end to go by, but we tried to really navigate the system the best way that we could. Assigned a case manager right away. The case manager went to the hospital to try to locate this client, spoke to social workers, spoke to nurses in order to really understand what the client is going through, why they're here. They helped to facilitate communication back with the family. So letting the family know that the client is safe, the client is okay, which is so important, especially back home. You don't understand. You're sending your child to a brand new country, new hopes, new dreams. You don't understand the challenges that they may be facing. So really try to help facilitate that communication between the family and with the person as well too. From there, we help them with financial assistance, immediate financial assistance for the time being, help them get into a shelter, as well as worked on getting their documents back. They had lost everything. They didn't even have a passport. Everything was stolen, everything was taken away from them. So helping them rebuild themselves from scratch, helping them go to the consulate with them, advocating for them, supporting them through the process is definitely ways that we've supported as well.
Yeah. ਜਦ ਆਪਾਂ ਨੂੰ ਪੰਜਾਬ ਤੋਂ ਵੀ ਕਾਫੀ ਪਰਿਵਾਰ ਦੇਖ ਰਹੇ ਹੋਣਗੇ ਹੈ ਨਾ ਇਸ ਵੀਡੀਓ ਨੂੰ, ਸੋ ਸਾਨੂੰ ਵੀ ਕਾਫੀ ਮੈਸੇਜ ਆਉਂਦੇ ਰਹਿੰਦੇ ਆ ਸੋਸ਼ਲ ਮੀਡੀਆ ਦੇ ਉੱਤੇ ਕਿ ਉਹਨਾਂ ਦੇ ਜਿੱਦਾਂ ਬੱਚਾ ਕੋਈ ਮਿਸਿੰਗ ਹੈ ਇੱਥੇ, ਅਤੇ ਆਨੋ ਮੋਸਟ ਆਫ ਟਾਈਮ ਆਪਾਂ ਵੀ ਜਿੱਦਾਂ PCHS ਨੂੰ ਰੀਚ ਆਊਟ ਕਰੀਦਾ, ਉਹ ਡੀਟੇਲਸ ਲੈਂਦੇ ਆ ਪਾਸਪੋਰਟ ਦੀਆਂ ਜਾਂ ਹੋਰ ਫੋਟੋਜ਼ ਵਗੈਰਾ ਹੈ ਨਾ, ਅਤੇ ਲੱਭਦੇ ਆ। ਅਤੇ ਹੁਣ ਮਤਲਬ ਈਵਨ ਇਸ ਵੇਲੇ ਵੀ ਆਪਾਂ ਸੋਸ਼ਲ ਮੀਡੀਆ 'ਤੇ ਦੇਖੀਦਾ ਐਵਰੀ ਅਦਰ ਡੇ ਕੋਈ ਨਾ ਕੋਈ ਫੋਟੋ ਆਈ ਹੁੰਦੀ ਆ, ਜਾਂ ਫਿਰ ਮਤਲਬ ਇੱਥੇ ਦਰਜਨਾਂ ਨੌਜਵਾਨ ਇਸ ਵੇਲੇ ਇੱਥੇ ਮਿਸਿੰਗ ਆ ਕੈਨੇਡਾ ਦੇ ਵਿੱਚ, ਅਤੇ ਮੋਸਟਲੀ ਉਹ ਸਿਚੁਏਸ਼ਨ ਹੁੰਦੀ ਆ ਕਿ ਜਾਂ ਤਾਂ ਉਹ ਹੋਮਲੈਸ ਹੁੰਦੇ ਆ, ਜਾਂ ਫਿਰ ਉਹ ਕਿਸੇ ਸ਼ੈਲਟਰ ਦੇ ਵਿੱਚ ਰਹਿ ਰਹੇ ਹੁੰਦੇ ਆ, ਕੋਈ ਉਹਨਾਂ ਦੇ ਕੋਲ ਡਿਵਾਈਸ ਨਹੀਂ ਹੁੰਦੀ, ਅਤੇ ਉਹਨਾਂ ਦਾ ਮਾਈਂਡ ਵੀ ਉਸ ਮਤਲਬ ਨੋਰਮਲ ਪੇਸ 'ਤੇ ਨਹੀਂ ਹੁੰਦਾ, ਉਹਨਾਂ ਨੂੰ ਆਪ ਨੂੰ ਨਹੀਂ ਪਤਾ ਹੁੰਦਾ ਉਹ ਕੀ ਕਰ ਰਹੇ ਆ ਜਾਂ ਉਹ ਕਿੱਥੇ ਹੈਗੇ ਆ। ਐਂਡ ਦੈਨ ਸ਼ੈਲਟਰਸ ਦੇ ਵਿੱਚ, ਡਿਟੈਂਸ਼ਨ ਸੈਂਟਰ ਦੇ ਵਿੱਚ ਵੀ ਆਪਣੇ ਬਹੁਤ ਜ਼ਿਆਦਾ ਨੌਜਵਾਨ ਹੈਗੇ ਆ ਜਿਨ੍ਹਾਂ ਨੇ ਆਪਣੇ ਘਰਦਿਆਂ ਦੇ ਨਾਲ ਕਈ ਮਹੀਨਿਆਂ ਤੋਂ ਗੱਲ ਨਹੀਂ ਕੀਤੀ। ਐਂਡ ਦੈਨ ਦਾ ਫੈਮਲੀਜ਼ ਆਰ ਜਸਟ ਪੈਨਿਕ, ਦੇ ਡੋਨਟ ਨੋ ਵਾਟ ਟੂ ਡੂ, ਕਿੱਥੋਂ ਲੱਭਣਾ ਉਹਨਾਂ ਨੂੰ ਜਾਂ ਹੋਰ ਹੈ ਨਾ। ਐਂਡ ਪਰ ਜੇਕਰ ਤੁਸੀਂ ਵੀ ਇੱਦਾਂ ਦੀ ਕਿਸੇ ਸਿਚੁਏਸ਼ਨ ਦੇ ਵਿੱਚ ਹੈਗੇ ਆ ਕਿ ਤੁਹਾਡੇ ਕੋਈ ਜਾਣ ਪਛਾਣ ਵਾਲਾ ਕੋਈ ਮਿਸਿੰਗ ਆ ਕਾਫੀ ਟਾਈਮ ਤੋਂ, ਜਾਂ ਫਿਰ ਤੁਹਾਨੂੰ ਪਤਾ ਆ ਕਿ ਉਹ ਕਿਸੇ ਇੱਦਾਂ ਦੀ ਸਿਚੁਏਸ਼ਨ ਦੇ ਵਿੱਚੋਂ ਲੰਘ ਰਹੇ ਆ, ਡਰੱਗ ਐਡਿਕਸ਼ਨ, ਉਹਨਾਂ ਦੇ ਪਾਸਪੋਰਟ ਵਗੈਰਾ ਐਕਸਪਾਇਰ ਆ, ਵੀਜ਼ਾ ਐਕਸਪਾਇਰ ਆ, ਜਾਂ ਵਰਕ ਪਰਮਿਟ ਐਕਸਪਾਇਰ ਹੋ ਗਿਆ ਆ, ਅਤੇ ਤੁਸੀਂ ਉਹਨਾਂ ਨੂੰ ਲੱਭਣਾ ਚਾਹੁੰਦੇ ਆ, ਜਾਂ ਤੁਹਾਨੂੰ ਵੈਸੇ ਲੱਗਦਾ ਕਿ ਉਹਨਾਂ ਨੂੰ ਕਿਸੇ ਹੈਲਪ ਦੀ ਲੋੜ ਆ, ਤੁਸੀਂ PCHS ਨੂੰ ਰੀਚ ਆਊਟ ਕਰ ਸਕਦੇ ਆ, ਅਤੇ ਇਹਨਾਂ ਦੇ ਜਿਹੜੇ ਵਰਕਰਸ ਹੈਗੇ ਆ ਜਾਂ ਇਹਨਾਂ ਦੇ ਜਿਹੜੇ ਕੇਸ ਵਰਕਰ ਹੈਗੇ ਆ ਉਹ ਜ਼ਰੂਰ ਤੁਹਾਡੀ ਹੈਲਪ ਕਰਨਗੇ ਉਸ ਸਿਚੁਏਸ਼ਨ ਦੇ ਵਿੱਚ। ਰੀਸੈਂਟਲੀ ਕਈ ਸਾਲਾਂ ਦੇ ਵਿੱਚ ਮੈਂ ਆਪ ਦੇਖਿਆ, ਜਿਹੜਾ ਸਾਡੇ ਕੋਲ ਵੀ ਜਿਹੜੇ ਵੀ ਰੀਚ ਆਊਟ ਕਰਦੇ ਆ ਆਪਾਂ ਉਹਨਾਂ ਨੂੰ ਵੀ ਰੈਫਰ ਕਰੀਦਾ ਉਹ ਕੇਸ। ਵੀ ਟਾਕ ਅਬਾਊਟ ਦ ਫੂਡ ਐਂਡ ਗਿਫਟ ਕਾਰਡ, ਦ ਕੂਪਨਸ ਦੈਟ ਯੂ ਮੈਂਸ਼ਨ, what were they?
So the gift cards, we give Walmart gift cards,
Hanji.
so they can buy groceries, medication, because of Walmart pharmacy as well
Hanji.
too, right? So if they need medication supports, they can kind of get everything, baby supplies, clothing, whatever they can. We try to give them, like, especially for example, we have walk-in clients all the time, right? So somebody comes in, they walk in, they need that support. That's something that we're able to provide right away.
Okay, so is there has to be a eligibility criteria that they need to meet, or how
It
you guys
depends on the
evaluate?
client situation. If
Okay.
a client, for example, they come in and they're saying that they have not eaten in like 2-3 days, they don't have food, they don't have money for diapers for their baby, they're really struggling, they don't have money for even clothes or hats or something in the winter as well too, we're going to provide them whatever immediate assistance we can, try to help them support.
Okay.
For anything a little bit more long term, for that, the eligibility criteria would be determined by, again, the team,
The case
the
worker.
appropriate team. But for immediate assistance, we do try to provide at least gift cards or something that we can help with.
How someone going through the situation can reach out to PCHS via phone, email, or if they can just walk in to one of your locations?
All of those options. You can give us a call, 905-677-0889. You'll receive a friendly voice at reception asking you what your concerns are, what they can support with as well too, helping you navigate through the process. You can look at our website online, www.pchs4u.com. You can, if you want to take another look at the services that we offer, the different supports, our brochures, our programming, everything we've kind of done over the last 35 years, that's an option as well too. Or simply just walk in to any one of our locations that we have.
Okay.
Let us know what you're going through and we'll do our best to help you navigate through the system and help you try to solve your problems.
Thanks for coming. It was great discussion, and I hope our listeners got to know so much about your organization and about the available resources in the community. Thanks for coming once again.
Thank you so much for your time.
Have a good one. Bye.